Burning feet at night? You're not imagining it, and you don't have to silently endure it. I'm a podiatrist, and every week I see people who describe the exact same problem. A burning, tingling, numb, or electric sensation in the feet that becomes much worse as soon as they lie down. Many tell me it keeps them awake at night, disrupts their sleep, and leaves them exhausted the next day. Tonight, I want to help you understand what's most likely behind that burning sensation, why it so often gets worse at night, what types of causes doctors usually look for first, and when it's important to pursue proper testing instead of guessing. If this sounds familiar, stay with me. Understanding what's happening is the first step toward making better decisions. When someone says, "my feet burn," they usually mean one of three sensations: a deep burning pain, numbness combined with tingling, or crawling or electric feeling under the skin. Clinically, many of these fall under the category of peripheral neuropathy, meaning the nerves in the feet are not functioning normally. However, burning sensations can also come from local nerve compression or from circulation-related problems. The key point to understand is this: burning feet are not simply normal aging, and they are not something you should ignore. In general, causes fall into two broad categories. First, there are systemic conditions that affect nerves throughout the body. Second, there are local or biomechanical problems that affect specific nerves in the foot and ankle. Understanding which category your symptoms fall into can make a big difference when you talk to a healthcare provider. A common question I hear is, why does the burning get worse at night? There are several reasons. When you lie down, the distractions of standing and walking stop, and the nervous system becomes more aware of damaged or irritated nerves. Blood flow patterns also change when you're horizontal, and in people with nerve or vascular problems, these shifts can amplify discomfort. In addition, small nerve fibers that carry pain signals are often more active at rest. This is why nighttime burning is so common, and why it's an important clue for clinicians. Let's start with systemic causes, because they're both common and often overlooked. Diabetes is by far the most frequent cause of burning feet. Over time, elevated blood sugar damages nerves, especially in the feet. Burning that worsens at night is a classic early warning sign. Even people with prediabetes can experience this. If blood sugar isn't well controlled, nerve damage can progress silently for years. Alcohol use is another important factor. Chronic or heavy alcohol consumption can directly damage peripheral nerves, leading to burning, numbness, and tingling. Many people don't connect these symptoms to alcohol, but reducing intake can sometimes slow progression and improve symptoms over time. Thyroid disease, particularly an underactive thyroid, can also contribute. Hypothyroidism can cause nerve irritation as well as swelling that compresses nerves. A simple blood test can help rule this out. Vitamin deficiencies, especially vitamin B12, are another classic cause. B12 is essential for nerve health, and low levels can produce burning, numbness, balance issues, and weakness. This is especially relevant for people who follow restrictive diets, have had stomach surgery, or take certain long-term medications. Some medications themselves can cause neuropathy. Certain chemotherapy agents, antivirals, and older antibiotic classes are known to irritate nerves. If symptoms began after starting a new medication, the timing matters and should be discussed with the prescribing doctor. Circulation problems can also play a role. Peripheral arterial disease, where blood flow to the feet is reduced, can cause pain that worsens at night. This type of pain may feel like burning or aching and can be associated with coldness, color changes, or weak pulses in the feet. This requires prompt medical evaluation. Age alone slightly increases risk, but age should never be accepted as the only explanation. Often, multiple mild factors, such as early diabetes, vitamin deficiency, and footwear issues, combine to produce symptoms. That's why proper evaluation matters. Now, let's look at local causes, because where you feel the burning provides valuable clues. Burning under the ball of the foot or between the toes often points toward Morton's neuroma, which is a thickening around a nerve between the toes. People describe it as burning, electric shocks, or feeling like there's something stuck in the shoe. Burning in the heel or along the inner heel can suggest nerve compression or irritation related to the plantar structures of the foot. Burning along the inside of the ankle and into the sole may indicate tarsal tunnel syndrome, where a nerve is compressed as it passes behind the ankle. Burning on the outside of the foot or ankle can sometimes relate to nerve irritation after ankle injuries or even referred pain from the lower back. Mapping exactly where the burning occurs: toes, ball of the foot, heel, inside or outside of the ankle, and noting what makes it better or worse is one of the most helpful things you can do before seeing a clinician. So how is this evaluated medically? A proper assessment begins with a detailed history and physical exam. Simple in-office tests can screen nerve function and sensation. Blood work is often used to look for underlying causes, such as blood sugar issues, thyroid problems, vitamin deficiencies, or metabolic imbalances. In some cases, imaging studies or nerve tests are used to better understand what's happening. The goal is not to guess, but to identify what is actually driving the symptoms. Who should you see first? Many people start with their primary care provider for basic testing. If symptoms are clearly localized to the foot, a podiatrist can evaluate biomechanical and nerve-related causes. If nerve testing is needed, a neurologist may be involved. The important thing is not to ignore symptoms or rely on trial and error alone. Here's where many people get stuck. Treatments often follow a stepwise approach, but frustration is common because many options only provide temporary relief. Creams, pills, massage tools, shoe changes, and stretches may help briefly, but they don't always address why the nerves are irritated in the first place. That's why symptoms often come back, especially at night. The most important step is understanding what is driving your symptoms specifically. For some people, it's blood sugar. For others, circulation, nerve compression, vitamin deficiency, or a combination of factors. Treating the wrong cause can waste time and delay meaningful improvement. If you want to understand the full picture, what commonly gets missed, how these factors connect, and what many people explore once they understand the root issue, there is a more detailed explanation linked in the description below. Many people choose to watch that before deciding what to do next. The key takeaway is this: burning feet at night are not something you should ignore, and they are rarely caused by just one simple issue. With the right information, you can have a more productive conversation with your doctor and avoid guessing your way through treatments. If this sounds like what you're dealing with, check the link in the description for the full explanation. Understanding what's happening is often the first step toward calmer nights.